What's up, YouTube? Doing some updates on the back, on my wife's back. Today is February 18th. Just did a 2-mile hike up a mountain, back down. Normally I could do that up in 20 minutes if I was moving pretty good. Today it took me 22 minutes. Latest updates. My wife had a discectomy around August 2024. She's doing much better. Every now and then she'll get a little, feels like a pull in the back of her hamstring, not much in her back. So that's good. I feel like the discectomy was a success. We kind of wish maybe we hadn't have done the operation, but I felt like based on what the surgeon said and how it looked on the MRI that it was probably going to keep giving her trouble until she had it cleaned up. My back, as you know, I had a revision where they came in from the front, took everything out, put new stuff in. That was in April of 2023. Was feeling 90% better, not 100%, but in November, a few days before Thanksgiving, I had a fall and my back was killing me. I thought I had broken the fusion. Went to my surgeon, they did an x-ray and they said, your fusion looks good, but you broke your L2 vertebrae, compression fracture. And you could see it on the x-ray from the one they did after my surgery to this one, big broken compression fracture. And they said, that's why your back's hurting. I still don't think my back was hurting because of that, because it felt lower, like it was right at the fusion level. I felt something pop right at that level, but who knows? It's getting better. Like I said, this is about the third time I've been able to walk the mountain, just walk it, not go hard. Just started lifting weights again very slowly. So just trying to recover and get back to where I was, pre-injury. Doing a lot of hot tub, sauna, massage gun. I went to a PT that my surgeon suggested. He was too aggressive. He had me using kettlebells, bending over, and that's the worst thing you want to do with a compression fracture. Had me doing weighted ball twist. He did do some dry needling, which hurt like hell, but it actually felt good. I had this one spot right in my lower back right side where it felt like a nerve was trapped or something, and the day after he would do the dry needling, I always felt better. I went to him about 3 days, but one day I started getting a lot of pain in my right leg, lower, towards the ankle, and I said, man, something's not right. Let's shut it down until I heal, and then what I'm going to do is just do what I've always done and rehab myself at home. Nothing crazy, a lot of walking. I still think the best exercise for back injuries is walking. Don't overdo it, don't underdo it. If you're in a lot of pain, walk. Let's say you walk a half a mile, mark your spot, and the next day try to go a little further. Decompress your back some, holding onto a bench or a tree, whatever, and just, every couple of days, see if you can get further and further. If it hurts more or earlier, then just stop. Other than that, you see all these reverse hyper machines and all this crap on TikTok and YouTube, Facebook, Meta, and all this. I don't think, unless you're not hurt, that stuff might work. If you're hurting, I don't think it's going to work. Massage, if you start getting leg pain, it's time to shut it down. Just walk, see a surgeon. If you got any questions, again, I do these videos partly for myself so I can look back and see where I was from the first surgery to the second to the third, what kind of pain, what kind of complaints I had. So I'm not trying to get views, make money, but if you got any questions, man, I've been to so many back surgeons and doctors and research. I've watched operations, You know, I've talked to guys from other countries, different surgeons, looked at my MRIs, looked at my fusions, x-rays, and CT scans. And so I may have some advice. Again, I'm not a doctor, but any questions, let me know. And hope everybody that's ever had sciatic pain, unless you're a doctor, I hope you find relief. And I hope there are some doctors out there that have had extreme sciatic pain, so they know what people are really dealing with. I mean, it's easy to meet with somebody for 10 minutes and then they walk out of the door and you don't think about them again. Man, when you're living, your wife, husband, man, and it's constant pain and they're complaining about it all the time or talking about it all the time, you know what it's like. So good luck to everybody experiencing pain. If you don't like your doctor, man, find another one. If you got to pay a little out of pocket, it's worth it to find that surgeon you really like. All right, hope everybody has a great 2025. Thanks.